You're watching ABC4 News.
Intermountain Healthcare is now employing a unique way to bring down suicides in Utah, handing out free gun locks. The organization and its partners announced a plan to distribute 20,000 free gun locks. They say the initiative is especially important right now in the midst of the pandemic, when firearms sales in Utah have increased along with psychological stress. The free gun locks are available at hospitals, clinics, and Harmon's grocery stores. If you or someone you know has thoughts of suicide, help is available at the number you see here on your screen. You can also get it on our website, abc4.com. Well, Intermountain Healthcare has also been on a mission to reduce surgery costs while improving patient care.
ABC4's medical correspondent Saray Chin reports how they've been able to discover millions of dollars in savings through artificial intelligence.
Dr. Raymond Price is the vice chair of the surgery department at Intermountain Healthcare. He also performs a lot of gallbladder surgeries and recently found a glitch in a computer system, had ordered certain pre-surgery tests that were unnecessary.
There were many blood tests that actually was being drawn on my patient. The AI system identified this, and I was contacted and asked, well, why are you one of the highest ones ordering these blood tests? And I said, I didn't know I was ordering those blood tests. And we looked at the system, and we really sat down and then reorganized how we did my preoperative patients so that we could really get rid of the waste that was in the system to really be much more of a better value for the patient.
Through artificial intelligence, Dr. David Scarda began looking at procedures, not just the day of surgery, but the cost of care from 30 days before to 90 days after surgery.
We identified that we had very similar surgeons caring for very similar patients who had very different overall costs. And these analytics allowed us to identify specific things that surgeons were doing or not doing that was dramatically impacting the cost of care.
Dr. Scarda is the medical director for Intermountain Healthcare's Center for Value-Based Surgery. He's been in charge of finding out how Intermountain could lower costs while improving patient outcomes. His work is being recognized in Modern Health magazine as the nation's class of top 25 innovators for 2020.
Getting this data and having the ability to do the analytics to figure out where our opportunities are is a real honor and a huge opportunity. My own family, we get healthcare and it costs a lot, and we need to figure out a way to fix that problem.
Fixing that problem, Dr. Price says, involves a tried and true formula.
The equation is quality and service divided by cost gives you the value.
That equation is saving patients and the healthcare system millions of dollars on just gallbladder surgery alone.
We estimate that for just this procedure alone, the opportunity for savings is between $4 and $6 million per year. We do many, many procedures, approximately 50 times more than just for this operation. And so the opportunities here are easily exceed $100 million.
And what's very interesting is we can usually provide better quality at a lower cost. Some people think, oh, we have to pay more to get better quality. But it's really shown over and over that if we can get rid of the waste, we can provide better quality.
Where do you see this and applying this in other surgeries throughout Intermountain Healthcare?
Oh, I think this can be used in almost every kind of procedure, any kind of care, though not just the state of Utah. This is the Intermountain West. We see patients from all the surrounding states in the system here as well. But as I work and teach not only here but around the world, taking these principles to Ghana, to Mongolia, to other countries, we've had opportunities to share these kinds of ideas and see if we can't implement this in low resource areas around the world. I think it has a real opportunity to have an opportunity to increase the quality of care, not just for our state, hopefully our country, but hopefully even much broader than that.
Saray Chin, ABC4 News.